at our Dublin facility, and then also down at, she spent some time at Riverside working with some of our urogynecologists. So big thanks to both of them for being here tonight. So Maggie will be our patient. We're going to show you how to do these exercises. So if someone says, hey, how do I do that stretch? Well, you're going to have a picture of it to take home with you, and the ladies are going to demonstrate it for you tonight. Where do we come up with these? Well, first of all, we're not going over training tips, shoe fit, recovery, or anything like that. You've already had plenty of that. Next thing, these are the 10 exercises. Now, we cheated on a couple. We gave you A, B, and C on a couple, but these are the ones that we're recurringly seeing and prescribing at our runner's clinic. Now, on Wednesday mornings, we do a runner's clinic. There's a flyer on it at the end of the thing if you want to know more about it. And we found ourselves routinely going over the same 6 or 8 or 10 exercises, and so we started jotting them down. So Joe Simcoe, who works with Dr. Bright, myself, we said, let's put these together. So we didn't invent these, okay? You can find them in any literature you want to look up about these exercises, but these are the ones we find ourselves seeing a ton of. So the first are the hip exercises. So Maggie, you ready? Okay, so simple sideline straight leg raises. Probably the number one thing that we're seeing that's a problem right now is the weakness on the athletes on the lateral side of the hip area, okay? So when they run, when you see somebody running from behind, okay, and you see that hip drop, that means they're weak on that other side, okay? So if you see that right side drop, okay, that means they got a weakness or an imbalance on the other side. So we try and strengthen both sides. So kind of imagine somebody that really swings like that, then they start getting arm swing, and then their back hurts. So you got a lot of things happening. So we do a simple sideline straight leg raise. You have them bring up to about right there. They don't have to come all the way up in the air, just about like that. We start off with sets of 10, okay? Everything can start with a set of 10. When they can do 1 set of 10, you go to 2. When they can do 2 sets of 10, you go to 3. When they get to 3 or 4 sets of 10, and it's really easy for them, then we'll put a little cuff weight either on the ankle, or if they're having knee pain, we'll put the cuff weight right above the knee, okay? 1 pound to start with. Again, 10, 20, 30, 40. When that gets real easy, then we can increase the weight, okay? Sideline straight leg raises.
How strong should it be? I mean, what's optimal?
They would be fatigued. Well, yeah, I mean, you start with just a 1 pound weight. About the most you ever get up to is somewhere between 5 and 7 pounds on a cuff weight. Once you can do 5 to 7 pounds on a cuff weight, you're ready for some sort of Nautilus type machine. Okay? Next one is a hip hiker. I didn't bring in one of the tables, but Ann's doing a good demonstration of this in the picture, and she can probably do it here. But what you're trying to do there is you don't want it to look like a teapot. Show them a little bit of it, Ann. I'm sorry I don't have a table for you there. You want to try and get them to do where they're hiking their hip. They're not tilting over like a teapot, okay? I'm sorry, the visual on that may not be great, but one thing you want to make sure they're not doing is a lot of the teapot type thing. You're trying to get them to use that hip muscle more than anything else. Sorry about we don't have the box in here. Steamboats. This one is with a TheraBand, and this is a slow exercise back and forth. Now you want to tie this rubber band that's around your leg, you want to tie that to something that's stable, okay? Not another person, not a chair that moves, okay? Something that's not going anywhere, like a big heavy table. The kitchen table works well. The other thing is that this is a slow exercise. So she's standing on the left leg. She's bringing the right leg back, nice and easy back and forth. Notice also she's not holding on to anything, okay? So the balance and the proprioception of doing this exercise back and forth real easy. Again, you're not trying to knock them over. You're just trying to get them to work on their balance and their strengthening. Which leg are they strengthening in this, Ben? The one they're standing on. Good answer, Ben. Thank you very much. The one they're standing on, okay? All right.
We do these 4 ways, right?
You can do them 4 ways. Absolutely, yes. The one that, obviously you can go front and back, and then the one coming out this way is real critical, okay? All right. The step downs, again, very similar to what we had with the hikers. On this one, notice she's coming down, just barely touching that heel, and then lifting back up, nice and easy. Again, sets of 10. All right? Start with 10, then go to 20, go to 30. When they get really good at this one, they'll be ready to do maybe like a little miniature squat or miniature leg press. But this is a good starting point. Again, it's a closed chain exercise. It simulates or mimics some of the activity that they'll be doing when they're standing on their feet or working on their feet. Okay? This one's a little bit of a visual. Can we get Ann or Maggie, you want to show this one? So you see the little stripe on the ground. What they're trying to do is to reach with their leg. They're doing a little bit of a squat, and they're reaching out with that leg. If you can see Ann there, or you can look in the picture, they're reaching with the leg, and they'll go in different angles. So imagine the face of a clock or the dial of a clock. So you maybe start having them reach straight ahead with their foot towards 12 o'clock and then say, do like 10 like that. And then maybe go for 2 or 3 o'clock and move them around the dial. This is real simple. All you're doing is advancement of that little step down that you saw, advancement of that mini squat. Nice and easy, down and back up. Okay, so you're working that stance leg and you're just reaching. So you're doing a little vector. You want to change the angle? Go to 230, go to 3. Give them a different target to shoot for. Everybody understand that one? All right, so these are real easy. We just found ourselves going over these exercises over and over again with these runners. Experienced runners who had a little trouble with their hips, everybody can benefit from some of these things. All right, hop back up here, Maggie. Now we'll talk about some of our core exercises. Now we have offended some of our runners on Wednesdays because they'll come in and they'll tell us they have done sit-ups. They can do sit-ups all day long. They can do curl-ups all day long. We ask them to hold a plank for 10 seconds. They fall on their face. They can't do it. So we're going to show you 3 different ways we do the plank exercise. Maggie will show you the first one here. And what we're trying to do is to make sure you're bridging, keeping the abdomen, keeping the belly, keeping everything flat and lifting that up off the ground. And then she's straightening out the leg just to give make it a little harder, okay? And this is the first of the core exercises, first of the bridging or core exercises. Now later in the year, Jeff and Tim are going to bring in some folks to do core exercises with us, and we can advance more of this, but this is a very basic one that we do, okay?
Do you go back and forth with your legs like that one?
Yeah, and you can hold it, make them hold it for 3 to 5 seconds without, you don't want their hip to drop. So when they're up here, you don't want them to drop their hip. So their hip needs to be stable.
Keep them real balanced, and if you see them swiveling, either dropping their belly down, or if it starts to tilt, then you know they got to work on that, okay? You asked Maggie how long to hold this. I forgot she was doing this at Cap City when I did the talk. She ended up holding the plank for like 7 minutes. So. All right, go ahead and flip over for us. So when you think of a traditional plank, you see in runner's world, they say do planks. This is probably the one most people think of for a plank. And again, you're looking for that sagging in the hips or sagging on the belly, and then also if they start to rotate a little bit. Okay, this is not a shoulder exercise. It's not an elbow exercise, but she's working hard with her low back, her abdomen, her gluteals, her upper quad. She's trying to keep that balance, okay? Start easy. Ask them to do 10 seconds, 15 seconds. If they can get to 30, they're doing really good, okay? You can relax. I just left her like that for a while last time. It was really fun. Okay, and now on the side. Now, some people you'll see do different things here. I think Maggie does them. You just sort of hold it, right, when you do these? Some people do like an arm thing just to make it more challenging, or time themselves, when they come up here and they go back down. These are hard, okay? And you throw in the arm swing, it gets a little bit harder because you've changed that lever arm. You've changed the dynamic of the exercise, okay? And then do you want to flip over, show them just so they can see on this side? So again, 4 different kinds of planks. Obviously the 2 sides are very similar, and we really emphasize this. This is a key part, and almost everybody can do a little bit better with this. Even folks that can do sit-ups all day long, they can almost always improve in how they're doing with their planks. Okay? Great. All right. Ann, you're up for this one, or Maggie. This is just a clamshell. So we're starting to think about some of those other hip musculature areas. This one will work on the abductors and adductors in the hips. Okay? And again, obviously, if you want to make it tougher, you put a little cuff weight right here, just a pound or 2, but they should be able to do 30 or 40 at a time before you start putting that cuff weight on. Okay? Or TheraBand, exactly, or manual resistance. Just giving somebody some manual resistance there will work as well. All right, Maggie, enough of that. So the grab-a-pens, we joke with Joe. He's still working on a better name for this. If you know Joe, he's up at night thinking of a better name. But right now, what we do is we throw a pen down on the ground, and you grab the pen, okay? So real easy. Ann's giving us a demonstration there. So grabbing for the pen, working for the pen. Again, this is that hamstring muscle with an eccentric firing, or a negative firing, if you will, on that hamstring muscle. The gluteals, hopefully you're holding your back. Some people think of this like the golfers picking up the ball out of the hole on the golf. So different things, different ways you can think of that, and you're trying to fire those hip muscles, again, fire those low back muscles. Okay, the last ones are going to be some stretching. 3 different kinds of stretches. Hamstring stretching. This one is on the standing with the leg on the steps. You can also do it just sitting on the table. And again, these are not going to be great on a bed or something really soft. They're going to be better on a table or a floor where you can really reinforce. If you sit on the bed, your hip's going to sink down. You're not getting as good of a stretch. So you want to lean forward and get that stretch. You know, same people say to rotate the foot in or out, or am I supposed to touch my nose down? You'll know, okay? If you get a good position here, if you let your knee down flat and then lean forward, when you stop is when that leg starts to pop up. Then it's not stretching anymore, okay? So leg flat, lean forward. We usually try to do at least 30 to 60 seconds on this. And where mistakes are made is when people start bouncing and doing crazy ballistic stretching or too fast of a stretch. So we ask them to hold it for a slow, steady, static stretch, okay? 30 to 60 seconds at a time, usually 4 or 5 on each leg. Quadricep stretch, this is where people get hurt because they fall over. So you'll notice Ann is holding onto the wall. Sometimes people do this when laying down. I do this when laying down. Sometimes you want to use a towel around if you're just starting and you can't get your leg all the way back there, you hook a towel around your foot. You can see in the picture right there, you can imagine if she was holding a towel looped around her foot to give you that stretch. Again, 30 to 60 seconds at a time. Remember when Dr. Bright showed you the pictures of the muscles? These are huge muscles, okay? They take a long time to stretch. It's not going to feel really stretched out on that first day. It's going to be sore the second day, but you're going to feel better each time, and you'll notice it'll start to stretch out even more.
I have a quick question about that one.
Yes, ma'am.
In the picture, she's using her opposite hand, and I've heard both.
Yeah.
Which, is there a reason that one's better?
I think it's just personal comfort. I think one thing you want to be careful of if you're really flexible and you take it with that same hand is you start coming out to the side too much. My personal preference is I do this when laying down. But sometimes, you know, if you're out warming up for a race and it's raining, you're not going to want to lay down on the ground. So it's good to know a couple different ways to do them. Okay? We okay? Last one is nope, sorry, 2 more. Piriformis stretch. Do you want to show this one, Maggie? This one's a little bit tricky, and it's harder to feel. It's one of those internal rotator muscles. Describe to him what you're doing, Maggie.
All right, so you want to get in like an all-fours position, and then you're going to bring one leg forward and cross your foot. You have to have kind of a lot of flexibility to do this, but you're crossing your foot over, and then you're going straight down into kind of a prayer position. Yeah. So again, I'll do it on the other side. So you're on all fours. You cross your leg across, okay? And then you slide this other leg straight down until you feel a stretch.
Show them how to do it laying on their back, too. You know that one? Okay, so an alternate way. Sometimes you have people that can't get on their belly, or a lady that's pregnant. You want to show them a different way to do it. A little bit different stretch.
Another way is you can cross the leg over here, and then you can grab and pull up. And you're stretching, I would be stretching this left hip this way.
Okay. This is a deep rotator muscle. This one's hard to get to. It's not the easiest stretch in the world. Greg did volunteer to demonstrate this one later for anyone that doesn't get the picture yet.
The figure 4 or the other one?
Well, he does them both. There's a silver, we won't go into what he's wearing. And then the heel cord stretch. So this is your Achilles tendon, your heel cord. Don't forget the gastrocnemius and the soleus. So a lot of times, where are you, Ann? Can we show this one? So take a peek around here. Wherever you want to do it. This is good right here. Just show them here. So when your leg is straight, when the back leg is straight, that's going to get the muscles right behind the knee. That's the gastrocnemius. That's the big, bulky muscle that you think about. But if you were to peel that back, there's another one down below called the soleus. So you have to actually bend that back leg, and that drops the stretch down a little bit lower. I don't think I have that one in a picture, but she's showing you right here. All you got to do is just keep in the same position. You keep the heel in the same spot, and just drop that back leg down a little bit. Drop that knee down towards the floor. And you feel the stretch go lower, too. So you can do the Achilles, you can do the gastroc for 30 seconds, and you can do the soleus for 30 seconds. Okay? Those of us that have got folks in their group that are a little bit of an advancing age, you know, you get over that age of 45, 50, 55, 60, all right? These muscles take a little bit longer to warm up, a little bit longer to get stretched out. So if they got to get there, you know, talk to them about getting there early. Jeff's email every week says, please get there early. So you can do some of these things, okay? Get your coffee, get your bathroom, and do a little bit of stretching. One PR point, I gave you this flyer on the Runners Clinic. If you have folks that are acutely injured, send them to see Dr. Bright. If you have folks that have a recurring problem or they just can't figure out what's a nagging something that they have, they got a wild, you know, thing in their gait or something weird with their arm swing or they're having trouble, we'll take them through the full assessment at the Runners Clinic. They see Dr. Bright. We put them on the treadmill for a video analysis. Tim comes in and checks their shoes. We do a force plate analysis to check how their foot's hitting the ground. And we do a full 4-day diet review with a dietitian, registered dietitian who is a runner also. So we take them through that. The exact cost is $350, but it's $325 for MIT runners.
Does insurance generally cover that?
Insurance generally does not cover that. So all on the Wednesday mornings. We do it from 7 a.m. until 10 a.m. And then right now we're just in the beginning of it. Just started in September. But as we get to the 6-month mark, then we'll begin seeing some of our follow-ups, runners coming back for follow-up.